All right. Well, here we are. I guess I'll introduce myself first, and then you can introduce yourself.
Yeah,
I'm James Spencer. I run HoboHealth.com. I was a traveler for a bunch of years, but now I'm settled here in Aspen, Colorado.
nice. I'm Steve Stockhausen. I run PTAdventures.com, and I'm did perm for about 2.5 years, and I've been traveling for nearly 7 now with my wife, who's also a PT, and our 2.5-year-old girl.
Yeah.
And
Yeah.
we're in the Bay Area, California right now.
And I guess a quick explanation of how we know each other is that we don't.
Yeah,
I think this is the first time we've connected online a lot, and I think this is
yeah,
the first time we're talking face to face.
yeah. We passed a few emails around, and I know I've been conscious of you and your page because we very first started, there was no other resources out there for travelers. I mean, literally nothing except for your site. And
Mhm.
so we were on there a bunch, and I got familiar with your name, and I think I started following you on Twitter or something like that. And then flash forward to like 2 years ago, and I'm at the Pikes Peak Marathon watching a buddy run, and all of a sudden I hear your name, and I reached out to you on Twitter. I think that's kind
Yeah,
of what
yeah.
started us
Let's
talking,
talk.
because I heard you finished that race. That's awesome.
I was like, holy cow! Someone I know, someone I sort of know was there.
Yeah, yeah,
That was so
yeah.
funny. I wish we could have connected that day, but
Oh, I know,
we didn't
crazy.
know. But yeah, and then I guess I became aware of you because my wife's a PT too, and we
Hmm.
had a kid and stopped traveling at that point and settled down here in Aspen where we had traveled a lot. And it was like, oh, holy cow, there's this PT couple out there that's continuing to do it with a kid. Like, let's watch and see how this goes.
Yeah, it's an adventure, that's for sure.
So you're in the Bay Area right now.
Hmm.
Um,
Yeah.
what are you doing there? When did you get there?
So we've been here off and on. I mean, we're going on 2 years. Like, so we our home base is Colorado as well, actually. And so we bought a house there a few years back. And so we worked here for a year, about as long as you can in one spot. And then we took basically 4 months off and went back to the house to do some stuff on the, renovations and things like that. And then, we'd been gone long enough that we could come back. So we're going to end up being here till July. So it'll be almost 2 years, but not fully straight through.
Gotcha.
But we're doing home health, and we're working not for Kaiser, but mainly with a lot of Kaiser clients. So we work for a third party. They're outsourcing a lot of their home health. So we're busy as ever. I mean, my wife is the busiest she's been in months, and I am as well. So with the whole COVID thing, it's for home health clinicians, it's pretty wild. So we're
Yeah.
staying busy for sure.
So,
Yeah.
so I should say, like, we're recording today on April 15th, 2020, right in the middle of this whole COVID thing. So
Yeah.
talk more about, what you're seeing in home care. Are you seeing COVID patients, or are you having
Yes.
to take more precautions? What's going
Yeah.
on there?
So we're pretty strict on precautions right now. They initially we were just wearing surgical masks and just, hand sanitize like crazy, wash your hands all the time, that kind of stuff. It's progressed to modified visits. They're actually Kaiser, because Kaiser is also the insurer, so we're able to kind of negotiate. Okay, so what does a visit look like for you guys? Which is really interesting. So Kaiser's now letting us do telehealth, although none of my clients want to do telehealth, but we can actually do telehealth and get reimbursed for it equally through Kaiser, which I think is a move. Right now, every insurance company needs to do that. They're doing it with the outpatient, as everyone's probably aware, but home health was not included in a lot of those rollouts.
Okay, and I
So
didn't
it's kind of
realize that.
it's kind of a case by case basis, and so we're able to do it with Kaiser because, like I said, they're the insurer. So even if you're Medicare, a lot of them it's Medicare Kaiser Advantage. So yeah, so that's pretty cool. But then the other thing that they said is we can do these modified visits where basically you call the patient up in their driveway and say, okay, take the subjective, how's that going? How the home exercise is going? You get as much as you possibly can without ever having to get within that 6 feet, and then you go in and you still get some exposure because you got to go in and take vitals and things like that. But you're minimizing that window of time where you could be exposed. Um, so that's interesting. I feel like it's pretty effective. I actually did a total hip discharge with someone standing in their doorway. I didn't have to, she was on one side, I was on the other, and, had her walk up and down to show me how she was doing. And she showed me her exercises holding the couch. And it was kind of great. She didn't want me to come in the house, but it worked out really well. So, but we're still wearing surgical masks now, but we're doing gloves. I've gotten to the point where unless they are a medically complex client, a lot of my patients refused altogether to be touched, so they won't even let me take vitals. There's a ton of fear, on the side of the patients. And even though we explain to them and I show them, like, here, I'm sanitizing the equipment right in front of you, I'll let it sit, on the pad and everything. And, they don't want to be, if you can, they don't want to be touched. So some clients I walk in with gloves, extra sanitizer, extra gloves, and my mask, and nothing to take vitals. It's kind of weird. Like, you almost feel like you're not, doing your job really. But
I mean, it's definitely like this is a different time, and we got to get innovative and practice in different ways. And like you said, like, people being scared, I mean, I'm here in a locked out patient clinic. We only have a few people coming in today, people who are they're all post-op. They're all really truly essential. People who can't walk, who, if they don't get PT now, they're going to be disabled forever. So it's down to just a few patients, but, like, doors locked. They call from the outside. We let them in, take their temperature. They're wearing masks. They're washing their hands when they come in, and people are still terrified of coming in here. I still get I get a person every couple of weeks who's been coming in here for a few weeks and says, like, "Oh, have you had any sick people?" They're asking those questions, like, almost timid to ask them, but it's like, no. Like, we're taking so much precaution, and I'm trying to show them all that. Just have them see me wiping everything down, because hey, I'm scared too. But
it's one of those things that it's hard to reassure patients, because like, every doctor that's treating COVID is not getting COVID. Like, that's one thing that people don't understand. Like, we have these precautions because they work. Like, if you do these things, and sometimes there's some steps to them, and but if you take proper precautions, like, you're going to be okay. It drastically reduces your chances of catching it. So I think a lot of patients don't realize that. We have some friends who are just shocked that we're even treating anyone. So you're getting back to your question, if we're seeing COVID. We're seeing right now, we're only seeing people under suspicion of possibly having it. No confirmed cases yet, but we've been told they are coming. And a lot of family and friends have been really worried for us. I'm like, no, like, these precautions, like, they work. Like, when flu season hits, I get the flu like once every 4 years maybe, but I'm seeing flu all in home health. Man, that I see, post pneumonia and flu patients all day long. This stuff. These precautions work for a reason. They're safe for a reason. So that's one thing that I think a lot of clinicians need to keep in mind. Like, you can still be safe. You're drastically reducing your chances.
Yeah. I think, alluding to what you said about how the COVID patients are coming, I'm just, like, I'm trying to predict this time when this is all over, right? Like, we're going to start seeing people who have been in bed being treated for like 2-3 weeks, who are completely and totally run down. And so we're going to have to see those COVID patients, but then everybody else has been laying on a couch too. Like, everybody's going to be so physically deteriorated after this. I think, I think we're seeing a lot of our colleagues out of their travel jobs, but pretty soon we're all going to be very busy and everybody's going to be hired. And I'm just trying to picture, like, what that looks like, trying to predict, which you can't.
Yeah, it's tough to know when it's going to bounce back. I mean, travel got hit so hard with, the two changes with SNF and home health reimbursement, October, then January, and then basically January again, with COVID. It's just, I mean, it's been pretty rough. I think hopefully Medicare will, change some things about how they decide to do this reimbursement after COVID, but it'd be really interesting to see how things come back for our industry, for sure. But it's got to pick up. I mean, definitely, it's going to pick up. Patients are going to come. We're all going to get comfortable with it. That, or acquired immunity eventually. If they don't get a vaccine out. So it's going to bounce back. It's just a matter of when.
Yeah. What are you hearing from other travelers as far as like I'm hearing a lot of basically all outpatient contracts have been cut, but I'm looking at you who's still working in home health.
I got some buddies right now who just got cut home health. So yeah, I mean, they're seeing an overall drop because I think a lot of the elective surgery type stuff is gone. You know, patients are too afraid to go to the hospital in general, so you're not getting those hospital discharges that, you know, because every once in a while you get the little deconditioned, you know, someone wasn't feeling right, went to the hospital, you know, they come back and it's low blood sugar, and so they have therapy, and you can help them get stronger. But like those are referrals that we're just not seeing right now. So yeah, I just, you know, over the weekend I just found out one of my buddies got canceled on. So and he's doing home health in the Bay Area as well, which is interesting. So
Mhm.
but you know, our like I was saying, I'm pretty busy. My wife is busy, but I'm also covering for two clinicians who are high risk, and so I'm taking over their territory in Oakland, working with like the inner city population there, and then my wife is covering my old territory and her own. So yeah, we're busy, but the company as a
Wow.
whole is still on the dip.
What are you guys doing for
So
childcare? You just one person
we,
works morning, one
oh
works
man,
afternoons, or
no, we lucked out. We found the best nanny in the whole world.
awesome.
So, and she and our little one just hit it off, and she enjoys working with us, and so it's about 6 hours a day. And you know, we told her pretty much, because we're guaranteed hours with being travelers, guaranteed 40. So the nice thing is, like, we have her set rate for her. So whether she works more or less, well, if she works more, we pay her more. But if she works less than, you know, the 6 hours a day that we kind of negotiated with her, you know, we just pay her the same. And we told her if we go on quarantine, you know, like we're good. We'll be able to keep paying her, because our company, fortunately, right now, our home health or our recruiting agency will pay 2 weeks of quarantine pay. So from that, we'd be able to still pay for that. So we kind of feel nice about having, you know, she's coming into our home, so that's kind of a risk, you know, right there. But you know, we've known her for so long; she's actually quite a homebody. So she doesn't. Yeah. Anyways, it's working out really well.
Well, I mean, like it sounds like, you know, I keep telling myself like I'm kind of like compartmentalizing the whole like work and private life from the fact that tens of thousands of people are dying right now, you know. But like if I
Yeah.
can really like focus on the professional thing, it's like, okay, I'm employed, um
Yeah.
got a newborn, so my wife was planning on being at home with the kids anyways. Like really not, if I can really just put it in a silo, like not much has changed. And but it sounds like you guys
Yeah.
have an awesome thing going on. I mean, you've got two
Oh man.
jobs and daycare
Yeah.
in the middle of this thing, so
Yeah.
good for you
It's
guys,
well,
you know.
you know, our lives haven't really changed too much. Like right behind me is the trail system that we go on. It's like, it's not a big trail, but it's, you know, I mean, it's for city trails. It's great. And we walk out there. We have two big dogs, so we got to walk them. We're in an apartment, so we got to walk them twice a day. After dog walk, hanging out with our little girl and work, like we don't have time to go out. We don't go out to eat anyways. So it's like our lives really, they haven't, you know, we can't go see our neighbors. We used to visit and have like little happy hours with the neighbors and stuff. Okay, we can't do that. That's it. Like our lives they're already pretty small already. So we're weathering pretty well.
That's good. That's good. Cool.
So
Well,
yeah,
before we started recording, we said we were going to keep this short, so I think we've done it. Just kind of shared
there we
some
go.
stories of what's going on out there. And
For sure.
you know, I guess the only thing I would add is if you're listening and your contract out there has been cut, there are some opportunities out there. FSBPT has some information on states that are allowing people to come in from other states to work. There's
Yeah.
opportunities to volunteer in this crisis through APTA.
Hmm.
There are ways to occupy yourself. Um,
Yeah.
and
Telehealth.
if you and it will come back. It will come back,
Yeah.
and we're gonna
Yeah.
get hit hard when it comes back.
Yeah. I mean, honestly, starting up your own telehealth. I don't know why more PTs don't do it. You know, it's something we've been putting in the works, but if you're not working, you got time,
Hmm.
and you can do it super cheap. Um, I think that's a great option, especially with the PT compact license. You know,
Hmm.
then you can see, it opens up your pool of patients to see just, you know, just diversify those skills a little bit more. Um, I think it'd be good.
Yeah, my wife, you know, she's spending most of her time with our two young ones right now, but found a way to squeak in a telehealth visit with her concierge practice,
Oh, yeah.
and it was a great experience. She's only done one, but we've kind of, you know, put the feelers out there to see if might be able to grab a couple more in this time. But
Yeah.
she set up like a little workout area in our house to show exercises, and it was a cool experience to see what that's like, and how we might be able to use that going forward, even past this time.
Yeah, it's going to be interesting to see how our industry changes long term
Yeah.
with this. But yeah, anyways, that's a whole nother conversation.
Yeah. All
So,
right, cool. It's been good
yeah, thanks a
talking.
lot
All
for
right.
sure.
Take care, and let's do this again sometime soon.